The impact of aging populations on rural states. As the U.S. population ages, rural states are facing unique challenges and opportunities related to their aging demographics. The increase in the elderly population is reshaping many aspects of life in these areas, affecting healthcare, infrastructure, and community dynamics. Here's a look at the impact of aging populations on rural states. 1. Healthcare access and services. One of the most pressing issues is ensuring adequate healthcare access for aging residents. Rural states often have fewer healthcare facilities and providers, leading to challenges in delivering geriatric care, chronic disease management, and emergency services. To address this, states are expanding telemedicine services, offering mobile health clinics, and incentivizing healthcare professionals to work in rural areas. 2. Economic impacts. An aging population can strain local economies in several ways. Older adults often have fixed incomes and reduced spending power, which can impact local businesses and tax revenues. Conversely, the aging population can create economic opportunities, such as demand for senior services, home modifications, and retirement communities. Rural states are exploring ways to stimulate economic growth by capitalizing on these emerging markets. 3. Workforce shortages. The aging population contributes to workforce shortages as many retirees leave the labor market. This is particularly acute in rural areas where younger residents may move to urban centers for better opportunities. To address this, states are focusing on training programs, workforce development initiatives, and attracting remote workers to fill gaps and support local economies. 4. Infrastructure needs. Aging populations often require modifications to existing infrastructure to ensure accessibility and safety. This includes the development of age-friendly housing, public transportation options, and community spaces that accommodate the needs of older adults. Rural states are investing in infrastructure improvements to support the mobility and independence of their aging residents. 5. Social and community services. Social isolation is a significant concern for older adults, especially in rural areas where community networks may be less robust. States are enhancing social services by funding senior centers, home visit programs, and community engagement initiatives. These services aim to combat isolation and provide support for mental health and social well-being. 6. Housing and living arrangements. The demand for suitable housing for older adults is rising. Rural states are addressing this by developing affordable senior housing, assisted living facilities, and age-friendly home modifications. Efforts include grants and incentives for developers to create housing that meets the needs of aging populations and promotes aging in place. 7. Transportation challenges. Access to reliable transportation is crucial for older adults, particularly in rural areas where public transit options may be limited. States are expanding transportation services for seniors, including rideshare programs, volunteer driver networks, and subsidized transportation options to ensure that older residents can access essential services and remain connected to their communities. 8. Family and caregiver support. Many older adults rely on family members or informal caregivers for support. Rural states are developing programs to assist family caregivers with respite care, training, and financial support. These programs aim to reduce caregiver stress and improve the quality of care for aging loved ones. 9. Economic incentives for aging-friendly businesses. To support the needs of an aging population, rural states are encouraging businesses to adopt age-friendly practices. This includes offering tax incentives for businesses that provide accessible services and support for older workers. States are also promoting entrepreneurship among older adults to leverage their experience and skills in local economies. 10. Policy and planning. Effective policy and planning are essential for addressing the challenges of an aging population. Rural states are developing comprehensive aging plans, long-term care strategies, and collaborative initiatives to ensure that services and infrastructure keep pace with demographic changes. These plans often involve coordination among government agencies, community organizations, and private sector partners. Conclusion. The impact of aging populations on rural states is profound, affecting healthcare, economy, infrastructure, and social services. By implementing targeted strategies and investing in necessary resources, rural states can address the challenges posed by an aging demographic while creating opportunities for growth and development. Effective planning, community engagement, and innovative solutions will be key to supporting the well-being and quality of life of older residents in rural areas.